Freezer, brain freeze. Oh man, that's awful. Strange shoulder growths, the ultimate brainiac, and the possible dangers of pregnancy tests. Today, we are breaking down and reacting to the quick, utterly insane medical scenes and wild injuries from Family Guy. Let's dive right in.
I'm sorry, Mayor McCheese, but I'm not sure if any cosmetic surgery is even possible.
Look, if it's a financial issue...
Well, it's not an issue of money. Your head is a cheeseburger. There's no blood flow to it. It's just dead cow meat.
If somebody wants to have surgery or you want a wound to heal, you need good blood flow to the area. A really good example of that would be a bad burn, a deep second-degree burn or a third-degree burn, where a burn surgeon needs to put a skin graft on the area.
All right, well, I appreciate you giving it to me straight.
All right, then. Have a tasty afternoon. Ah, there's a smile.
If you have no blood flow to the area, eventually the tissue is going to die. We see this often with people who have peripheral vascular disease, where their blood vessels just slowly stop providing blood, will cause that tissue to have ischemia, will break down and die and necrose.
He's dead, just like the Pink Panther.
Well, it seems his lungs are completely filled with Owens Corning fiberglass insulation.
Oh my gosh, that's really funny and really messed up. Fiberglass. Remember, when you do install this stuff, make sure you're not inhaling it. Use maybe a respirator or a mask so you're not breathing this stuff in.
1/3 of his body weight is Owens Corning fiberglass insulation. Well, that's it. But don't worry, he won't burn in hell, thanks to all that Owens Corning fiberglass insulation.
Oh my gosh. We're seeing nasal cannula, some IV fluids, and the cardiac monitor going on over here. It doesn't flash when the heart stops like that. The common rhythms that we see at end of life, bradycardia is probably the most common one that we see as someone slowly passing.
Now return to Dr. Terry Fabulous, homosexual gynecologist.
Okay, Mrs. Robinson, let's take a look.
So first off, who cares if somebody is a homosexual and a doctor? Whatever your specialty is. Kind of weird that they started this way.
Ew, it looks like a sad old man.
That's so stupid. Totally inappropriate when I'm looking at it from a medical standpoint. She's in the stirrups. She's probably just doing a general gynecological exam. May need to do pap smear, or maybe there's a complaint that this individual needs to have it checked.
Well, it sounds to me like you're a regular Benedict Arnold Drummond.
What's he expecting us to cut to?
I think he wants maybe, I don't know, Gary Coleman and a Napoleon hat?
But we don't have that. We gotta come up with something.
Well, we got the Cowardly Lion as Lindsay Lohan's gynecologist.
Play it.
People will come to the emergency department for female medical complaints. Sometimes it's from an OB standpoint, so obstetrics, or sometimes it's related to gynecological issues. Most common reasons we see people coming in that need an exam down there would be an infection, pain. Those are your two big things.
I'm gonna check her for diseases. There's just one thing I want you to do.
What's that?
Talk me out of it.
No.
There's a baby on the wall here in the picture. People will come to the emergency department for obstetrical issues, usually vaginal bleeding in early pregnancy. That is a common time we'll see individuals, so they need blood work and an ultrasound. You don't necessarily need to do a pelvic exam.
What the hell is going on up there?
We'll have patients that come into the emergency department talking to themselves. Depending on the scenario, sometimes if there's no risk to anybody else, they don't want to hurt themselves, they're not what we call gravely disabled, there's not a lot of things that we can do. But if there are other components where their safety is compromised or they're thinking about hurting themselves or others, it's a different scenario where we have a duty to act in the emergency department.
Oh, I'm feeling nauseous. I think I got altitude sickness.
Oh, that's so disgusting. Altitude sickness typically happens when people go from one level to another, meaning like sea level up to 6,000 to 8,000 feet. People can start feeling uncomfortable headache, fatigue, shortness of breath, nausea. You can get cerebral edema, or you can get fluid in your lungs.
Hey, Brian, you want a pukesicle?
I would love a pukesicle.
That is hilarious. The fastest way to treat altitude sickness is actually to descend, to get to a lower altitude. There are sometimes medications that you can use. Oxygen will help. Staying hydrated will help.
Meg, have you seen Dad?
Yeah, he's at the dentist. He's trying to get sick.
Okay, go ahead and spit.
It's okay, go ahead.
What? We have patients that do come to the emergency department spitting quite often. They'll actually put you in a spit mask to prevent you from spitting on staff members. In the emergency department, dental things don't come in that often, and if they are, they're emergency.
Be later. Why do you look so nervous?
Yeah, I promised a kid in the hospital I'd hit a home run for him.
There is something called the Make-A-Wish Foundation that I believe allows kids that might be terminal or really sick to make a wish, maybe meet celebrities or go do an activity that they really wanted to do. So really good. You might see this in the hospital. Donate to it if you have the means to be able to do so.
Sorry, I struck out looking. Wait, you're not the kid I promised.
No, he died last night.
Oh, phew.
Cancer in pediatrics is very sad, but it's also a population that actually does really well in the sense of there are treatments. Kids are very robust and strong, and they do have positive outcomes.
Yeah, what the hell? Go shoot some animals. That sounds like fun.
Hey, it beats sitting at home watching Meg pop her zits.
That's disgusting. You ever wake up with that weird backache and just blame it on getting older or sitting too long? Fun fact, it might actually be your bed. So this room basically turned into storage, which was fine until my dad said he was coming to visit. That's when I realized you can sleep next to the treadmill probably isn't the move. So I decided to finally upgrade the setup. I wanted something simple. I ended up going with this Japanese joinery bed frame from FlexiSpot. It's solid wood, no screws, and it basically slides together and locks tight. No wobble, no squeak, no stress. It's clean and sturdy and perfect if you just moved into your first apartment or your current mattress is sagging, you wake up sore, it's got, lots of stains, or you can feel every spring when you roll over. That's your sign it's time for a new one. I paired it with their U3 hybrid mattress. It's made in the US and CertiPure US certified, so no weird chemicals or mystery foam. It feels like one of those premium mattresses without breaking the bank. Plus, you get a 365-night trial and lifetime warranty. So if you hate it, send it back if you don't see a difference, which you definitely will. As an ER doctor, I know how much sleep affects recovery, focus, and mood. So honestly, fixing this room was more than a makeover. It was a health decision. And now that it's done, I'm starting to think I probably should have set this up in my room. If you've been ignoring upgrading your bed, take this as a sign to upgrade and check out FlexiSpot using the link below. Oi, oi. Oh my gosh, that's so disgusting. Don't pop is it, especially if they're like big, large, not ready, because you may not be able to pop it. It might make it worse, more swelling. I've seen people come in with big abscesses, cellulitis on the face, and it just turns into something bad.
Lois, you've met Tom Tucker.
Oh, yes, of course. I loved that piece you did on the invention of the guillotine.
Oh, thank you. Half the time those things didn't really work.
The guillotine sometimes didn't work because it was used so often that the blade would actually get dull, and sometimes people would have to have it dropped multiple times. Awful.
How was it, honey?
They couldn't finish.
Oh, really?
Yeah, I gotta go back tomorrow.
Oh, well, I made cabbage for dinner.
Yeah, that would be the ending to this day.
We know with that amount of a severed head, you would not be able to talk, but it's quite interesting because they thought after somebody had a head severed that their eyes were moving still and there was potential consciousness after having a severed head, but unlikely the case.
Ugh, this is going to be more painful to watch than when he ate half a fudgesicle in one bite.
Brain freeze.
Brain freeze!
Having to do with super cold, hitting the nerves in the mouth. There's a fast way to fix it. Just quickly put a clean thumb and push it to the roof of your hard palate. It'll warm up that area and decrease that horrible signaling of the cold, and things will calm down.
Oh boy, a fudgesicle!
Freezer, brain freeze. Oh man, that's awful. Anatomy wise, I don't know what we're seeing here. We just got some pieces and some blood everywhere, and then there's just a hollow place where you would normally see the lungs actually if that tissue was gone, but it looks like we're seeing a little bit of leftover brain matter for Peter here.
Yes, you'll be about as effective as the Wizard of Oz was at granting wishes.
And Dorothy, you wanted herpes. But little did you know, you've had herpes all along.
I didn't want herpes.
Oh. Well, you've got it.
What is herpes?
Herpes.
Herpes is a virus. There's herpes simplex 1 and herpes simplex 2. Typically, it's a virus that you get from somebody else. And same with simplex 2. It's down in the nether regions. And yes, it is typically a sexually transmitted infection and causes blisters and ulcers, and they hurt a lot.
You like crab? There's a
crab place right around the corner. The hell are you doing? I'm using my knowledge of the local food scene to get this woman to go to bed with me. Well, now we know. I can taste what he eats.
This is a parasitic twin. It's a rare form of a type of conjoined twins where it's almost fully absorbed by the one twin, but there's still pieces left. Very rare, I've never seen it before.
Well, finally, something in my life that makes me feel special. I mean, except for when I had those cow udders. So, as you can see, the fiscal projections for the fourth quarter make this thing a slam dunk.
Cow udders are very similar to humans, produces milk for the offspring. There are people that do have multiple nipples. There's something called a supernumerary nipple, where you might have an extra one.
You told me it was a nubbin.
Any questions? Not about my cow udders. All right, then. Looks like we got ourselves a deal. This is cause for celebration.
Oh my gosh. And if there is a male or anybody who's not breastfeeding and you have discharge from your nipples, you need to get checked out by a doctor. The concern would be cancer or you're having inappropriate hormone release.
Meg, please stop. I know your heart's in the right place, but...
Actually, it's not. It's a serious medical condition.
Whoa.
Yeah, that's not supposed to be there, so she should probably always wear a hat.
Majority of the time, the normal place for the heart would be centrally aiming to the left. But there are people that have dextrocardia, meaning that the heart goes to the right, and that is fine. Sometimes people can have something called situs inversus, where they have a flip of all of the organs, not just of the heart.
Oh my God, it's so creepy to think there were strangers in our house. I've never felt so scared.
I have.
What?
Now we wait.
A man can take a pregnancy test to see if they're inappropriately excreting hormone that's not theirs, HCG, because sometimes it actually could be a cancer marker. In men, this would be normal in pregnancy, typically peaking near the end of the first trimester and then slowly goes down. Wow, Family Guy cutaways. Some of these were intense, some of them were a little off and confusing to me, but most of them downright disturbing. If you guys enjoyed this, definitely check out this playlist right here. And as always, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.